here. All right, so I'm going to take it off this thing. There we go. Okay, so here we go. Here's the heart model. A couple of things you can see. I was trying to tell some people, if you can see kind of the letter M with the fat that's laying down, that'll sort of tell you that you're looking at the anterior surface of the heart. Probably, and then what you see on these different surfaces, you see these grooves. Well, you don't actually see the grooves. What you're going to see is fat laying over top of the grooves. If you peel back the fat, then you'll find the blood vessels, and the blood vessels are basically sitting in these grooves. There's a groove on the front called the anterior interventricular sulcus, and inside that groove, the anterior interventricular coronary is sitting there, as well as the great cardiac vein. They sit inside of that anterior groove. On the back side, this would be where the posterior interventricular sulcus is, and there you have the posterior interventricular coronary artery, and you have the middle cardiac vein inside of where that groove would be. What's this pointy part down here called? That's the base, and then basically back here, excuse me, that's the apex. Did I just say base? It's a long thing. That's the apex, and then back here would be where the base is. Okay? You can see this is the apex down here. That's mostly made up of the tip of the left ventricle, and this back here is mostly made up of the back wall of the left atrium. That's principally what that's going to be back there. All right. Other things you can see before you get too far in. What's this guy going up here?
Vena Cava.
Which one?
Superior.
That's the superior vena cava. And then this down here that they kind of cut, what would that be?
Inferior.
That'd be the inferior vena cava. What's this thing here?
Aorta.
Yeah, that's the aorta. Technically speaking, this part that goes up is called the ascending aorta. Then this is called the...
Transverse?
That'd be a good name. Have you read that someplace?
No.
Okay. No, it's called the arch of the aorta. I like transverse, but yeah, that's called the arch of the aorta. And then back here where it starts to go down, it's called the descending aorta. Coming off of the aorta are three branches, at least three big branches that you can see up here. This is called the brachiocephalic trunk, or the brachiocephalic artery. Then you have a right common carotid artery, a left common carotid artery, sorry, and then you have a left subclavian artery. Okay? So brachiocephalic artery, left common carotid, left subclavian artery. You'll learn more about those later on. This thing coming out right in front on the anterior surface, this is the pulmonary trunk. And then it gives off basically two big branches called the pulmonary arteries. Okay? Other things you can see on the back side, if you turn it around, these four guys that empty into the back of the left atrium, these are called the pulmonary veins. There's usually four of them. Your sheep hearts, they like cut so close to the sheep heart that you didn't see the four branches. Instead, all you saw was just one big hole in the back of the left atrium, but there are actually four pulmonary veins that feed in there.
So they put them red?
Yeah, because they're going to be veins, but they're carrying freshly oxygenated blood from the lungs and dumping it into the left atrium. Okay, so yeah, I think that's most of the big blood vessels I wanted to say. One thing I wanted to mention was the this thing right here. This is the Ligamentum Arteriosum, that little thing that's shown right there. I think is that listed as something you need to know? You want to see it? Yes, it is. Why am I not seeing it? Oh, yeah. Yeah, this little thing right here doesn't look like much, but that's called the Ligamentum Arteriosum. It's not much in adults, but in utero, in a fetus or an embryo, that's actually called the ductus arteriosus, and it's a little passageway that allows blood to flow straight from the pulmonary trunk right into the aorta. It's another thing that the fetus has that allows blood to bypass the lungs. Okay? There's two things that prevent blood from getting into the lungs in the fetus. The foramen ovale, which connects the right atrium with the left atrium, and then this ductus arteriosus that connects the pulmonary trunk with the aorta. Okay? Those are two ways that you can bypass the lungs. Both of those things should close up after the baby's born and once you get normal circulation going. Okay? All right. Other things I can see up just on the outside before I get too far. Let me talk about what's this little thing called here?
Atrium.
Oh, well, it's the atrium, but what's that area called? The auricle, right? This is the right auricle, which is part of the right atrium, and then this over here is the left auricle, which is part of the left atrium. Now, if you pull this away, it's if anyone ever asks you what are the first branches off of the aorta, don't say one of these guys. Even though you might look at it and say, well, wait, isn't that the very first branch off of the aorta? No, it's a trick question. The first branches off the aorta are the coronary arteries, and really the only way you can see them, they're behind the pulmonary trunk. So on these models, if we're lucky, I don't know what this model does, but if you pull this apart, yeah, you can sort of see it. This here, it doesn't look like much, but that's the opening of the right coronary artery. It's coming right off of the aorta. And then if you flip over here, that's the opening of the left coronary artery. It's coming also off of the aorta. So those are actually, it's like I said, the heart's kind of smart. It's like, let's take care of ourselves first before we send out blood to the rest of the body, basically. Okay. All right, let me show you some other things. Back on here, quick. Again, make sure you know your coronary blood vessels. So this would be the anterior interventricular coronary artery, or you can call it the left anterior descending. This would be the great cardiac vein that's following alongside it. This over here is the circumflex coronary artery. Okay. Over here, this would be the right coronary artery, and then this branch is the marginal branch going down, and then this one that goes around and behind is the posterior interventricular coronary artery. This vein that you see here is the middle cardiac vein. And then this big kind of dilated blue area that you see here, that's the coronary sinus, and that's going to collect all of the deoxygenated blood from the heart and dump it into the inside of the right atrium. So let's go on to that now. So if you look, here's the right atrium. This is the right atrium. Up here, you have the opening of the superior vena cava, so that's bringing deoxygenated blood from the head and dumping it in there. Down here, you have the inferior vena cava, that's bringing deoxygenated blood from the legs and from the torso and dumping it in. And then this little dot that you're seeing there, that's supposed to represent the opening of this thing, which is the coronary sinus, which is also dumping blood into the right atrium. Okay? Other things that you can see inside of the right atrium, here's the auricle part of the right atrium, and these little things that you see in here are called the pectinate muscles, I believe, which stands for like little teeth or something. I'm not really sure what it means. So those are called pectinate muscles. What would this thing be?
Coronary.
What is it? Somebody said it. This is the tricuspid valve, or you could also call it the right AV valve. Either name's fine. This in here, what would these little things be? Those are the chordae tendineae. Okay. This one pulled off a little bit, looks like, but these chordae tendineae are attached to little muscles that are called the papillary muscles. So this one came off, but the little muscles that are inside of the ventricles that anchor the chordae tendineae have a name. They're called papillary muscles. These weird patterns that you see inside of the ventricles, they kind of look like the pectinate muscle that's inside of the atria, except they have a special name. They're called trabeculae carnae, which means fleshy or meaty beams. I don't know, whatever. So those are those guys. So let me back up. So get your bearings. This is the right atrium, tricuspid valve. You're then inside of the right ventricle. You'd then go up and out through here. This is the pulmonary valve, also known as the right semilunar valve. You would then be into the pulmonary trunk, which would then take you into the pulmonary arteries. You'd go to the lungs, you'd pick up oxygen, you'd come back to the heart via these four guys, the pulmonary veins, and they dump into this guy, which is the left atrium. Okay. By the way, they're showing this dot here. That dot is actually supposed to represent the foraminal valley. That would be you wouldn't see that hole in an adult, but you'd see that hole in the fetus. So this hole, as well as this little connector, are the two ways that blood can bypass the lungs like in a fetus. Here's the left atrium. This then would be what? That's the bicuspid valve, or you can call it the mitral valve, or you can call it the left AV valve. You go down through there, you then would be into the left ventricle. Then what's this? That's the aortic valve, or you could call it the left semilunar valve. If you go through there, then you go into the arch of the aorta and you go out to the rest of the body. This thing in the middle is the interventricular septum, as I mentioned. Again, if you don't know what piece of the heart I'm giving you, and I ask you to name a chamber, if you just want to get your bearings, always look at the thickness of the outer wall. Okay? Compare this thickness with that thickness over there. Where it's thicker, it's going to be the left ventricle. Where it's thinner, it's going to be the right ventricle. So if I show you this piece of the heart, don't be caught off guard. Look at the thickness. This is thicker over here than that is over there, so you know this is going to be the left ventricle here. This is going to be the right ventricle over there. If you follow that rule, you shouldn't get messed up when you look at things. Let me go on to the sheep heart very quickly.